Hello everyone, my name is Sarah and I work in the sales and marketing team at Whatnot Naturals. Today I'm excited to bring you some fantastic information which we hope you will find very useful about a very common eye condition that affects children and babies called blepharitis. Blepharitis is inflammation of the eyelids, causing them to become red, swollen, burning or sore and have flakes or crusts at the base of the eyelashes. I will be chatting to Dr. Catt and Dr. Michael Jones, who are ophthalmologists or eye specialists from Sydney Ophthalmic Specialists based in Sydney. Dr. Catt graduated with an undergraduate, a medical and a master's degree from the University of Sydney and the Flinders University of South Australia. She has a keen interest in teaching ophthalmologists in training and is a clinical senior lecturer at the University of Sydney. Dr. Michael Jones is currently the head of the Department of Ophthalmology at the Children's Hospital Westmead. He is head of the Strabismus unit at the Sydney Eye Hospital and a senior clinical lecturer with the University of Sydney. Thank you so much for your time, Dr. Catt and Dr. Jones.
So blepharitis is a really common condition, seen much more commonly in adults compared to children and babies, but certainly does occur in that population, and it's often underdiagnosed in children and babies as well. So if you think about the word blepharitis, it's got two components. So bleph refers to eyelid, and itis, whenever something contains itis, it means inflammation. So blepharitis means inflammation of the eyelid. And in this particular disease, it refers to inflammation of the eyelid margin. So it's an inflammatory condition. It can sometimes have an infective component. So it can sometimes be related to infection with certain bacteria, such as Staphylococcus or Streptococcus, or even some viral infections. So herpes simplex virus or the chickenpox virus can also be associated with blepharitis. And other inflammatory conditions like rosacea can also cause blepharitis. In babies and toddlers, it's usually an inflammatory condition, not related to those infections, but all the infection can contribute to it as well.
Okay.
It's uncommon in babies under 12 months, but what I'd say is you never say never in health and medicine, because my little baby, my second baby, had a chalazion and had some blepharitis at the age of 6 weeks. So the textbooks aren't always applicable to every single.
In kids, it's a type of condition related again to gland production. They can get some parts of that being a blockage in the gland itself, which we call a meibomian cyst or a chalazion. Some people call them a sty. It doesn't really matter what you call it, but you can get gland blockages or lumps in your eyelids.
Mm-hmm.
Kids also often, because of the allergic component that goes with that, they present often with that, with blinking and eye rolling or eye rubbing. And we see that actually a lot more than in kids with screen time, actually, because if the kid's watching a screen, so homeschooling of course brings this on, also TV watching, and you don't blink quite as much when you watch a screen, your eye dries out, so that's another sign.
Okay.
But it's important because that feeds back into the allergy side, and in kids, allergy can become an autoimmune problem, and the cornea and the front of the eye can become unhealthy or damaged.
Mm-hmm.
So it's actually worth being aware of these situations where kids are symptomatic, that there's probably something worth checking out.
Okay.
And then older people will typically complain of just the dry eyes. So we'll feel it as an adult more, that you get a little bit of this feeling of a grittiness or a sandy feeling in your eyes.
Yeah.
And there can be, of course, some redness in the eye, but it tends to be much more the sensation of the dryness that the adults feel.
Okay. So would it be worse for someone with contact lenses? Would that aggravate it a bit more, I guess?
Yeah, absolutely. So a contact lens, as good as the design of the contact lenses these days, is a foreign body. So they tend to cause a little bit of irritation on the surface. Some lens types are more prone to it than others, and that lens technology change has meant that a lot of the lens coating is a lot more water friendly, and so there's a little bit less irritation than you have with the old ones. But it has a tendency to, because there's a bit of movement, a bit of rubbing on the eye, cause a bit more irritation. And then on the other side of that is, of course, then the eyelid being rubbed as well. So people who have allergic or inflamed eyes or blepharitis will be running a little bit of a risk with a contact lens of having a greater issue with that, or dry eyes, which is manageable, but you have to certainly just be aware that that's another factor to think about. And then how much you wear contact is important, the type of contact you wear. So there's a few factors that you can make life better, because again, it's not that you can't do it, it just has to be thought of or dealt with a slightly different way. It's actually pretty ubiquitous, I'd say. There isn't anyone who's really immune from it, to be honest. So you would definitely see it in some families and skin types. So you do have people, if there's a family history, having to be aware that if you inherit dad's skin, as I said, a lot of kids will get lumps and blepharitis, and it could be akin to the younger kids, somewhere between 3 and 10, getting these styes, glazions and cysts, whereas teenagers get pimples. And that is a skin type that runs in families. People with allergies in another way as well. So in those children, if you have atopy, which means you might have asthma or eczema, but you can have allergic eye disease without having those things as well. And then in adults, there's a couple of conditions specifically that cause this more commonly, and rosacea is one. So ocular rosacea is inflammation of the eyelids associated with the more significant blepharitis, and then that's also a component of what can be an issue with other inflammatory or connective tissue diseases. So there's a long list of dry eye symptoms and syndromes. Sjogren's syndrome, for example, where you get salivary gland and lacrimal gland change, which means that you don't produce the same tears, are very prone to this, because the lid health, the eyelid component of the tear film and the surface of the eye is extremely important. And it's almost like it's a key part of the equation. If you miss the treatment for that, then you can become very much untreatable in terms of your symptoms. Okay. But there are a few anyway. Obviously, you have to think of everyone individually.
It's diagnosed with a combination of history, so listening to the patient's experience of their symptoms, and also what the parent, and in the context of children, what the parents can tell you as well. Mm-hmm. The most powerful way to diagnose blepharitis is actually to look at the eyelid margins. So we're using a piece of equipment called a slit lamp, which is like a big microscope that lets us look at the front of the eye. Mm-hmm. And we can see the meibomian glands, which are the glands that run along the back of the eyelid. And some of the features we can look for are caps of oil sitting on top of those meibomian glands, or we can see that the glandular secretions are actually all stuck inside the gland. So we call that meibomian gland inspissation. Okay. We can also sometimes see crusts or little collarettes which sort of stick around the roots of the eyelashes. And we can also see some of the sequelae of blepharitis, such as conjunctivitis, or dry spots on the cornea, or in more chronic conditions, you might get little blood vessels growing onto the cornea, which is normally completely avascular and has no blood vessels growing on it at all.
Okay.
There's a number of different ways to treat blepharitis, and the underlying principle is to reduce inflammation within the eyelid. So some really important things to do is to make sure you remove all your eye makeup at the end of the day, because that sort of foreign material staying there for a long time can sort of worsen any blepharitis.
Sure.
The other thing that I always counsel patients to do is to apply a warm compress over the eyes once or twice a day. And I'd just recommend using a washer, and you get it warm with sort of bath temperature water, which you bring out, and then you can hold it over, the eye one at a time for at least 30 seconds. And what that heat does is it actually heats up the oil in the oil glands of the eyelid. Mm-hmm. And just like if you're heating up butter, it flows more easily. If you heat up the oil in the lids, it flows more easily. You can actually get out of the glands and onto the surface of the eye where it's supposed to be. The other thing would be to clean right along the roots of the lashes. So where you get those crusts and collarettes and that inflammatory debris accumulating around the lashes, there's a number of different products you can use to really clean right along the roots of the eyelashes. I often say to women that the place you want to clean is right where your eyeliner would be, along those lash roots.
Okay.
And then there's a number of other treatments you can use as well. So often blepharitis occurs in association with dry eye. So lubricating eye drops can help. We also know that ensuring that you take enough omega-3 fish oil into your diet, either through eating oily fish or through a dietary supplement, can be helpful as well.
Okay.
And then in certain conditions, there's role for oral antibiotics or topical antibiotics, or even topical steroids.
Okay.
There's essentially a few different arms to this, because everything feeds on itself, because the surface of the eye, the tear film, is influenced by the lid and the blepharitis, and then the components of that being the oil gland production and the tear production itself. So there's a lot of different ways of treating it. I think lid care is actually fundamental, particular, for example, kids with chalazions. I can instruct them on lid hygiene and lid care, and with a good routine with that, once you get them over the initial presentation, and there could be very targeted treatments for that, with everything ranging from antibiotics orally to topically to steroids to surgery. But once they're through the first round of treatment with that, if they do good lid care, then they don't need to come back, in my experience. And it's only the ones that stop doing the lid care of the lid washing that tend to come back. Okay. There's also a similar sort of logic with the adults as well, actually. So there's very much a regime of lid cleaning, lid washing, lid hygiene. Not that anyone's dirty or it's an infection per se, but there's a bacterial component to it as well. So targeting those treatments. And I do emphasize then the ocular surface. So we want to protect vision and make sure the cornea is healthy, and there'd be some more targeted treatments for that as well.
Okay, so with just general daily cleaning, so would you use like just a gentle baby wash or something? Is that what you're talking about when you say, you know,
yep,
lid cleansing?
I keep it very simple, I think, for a couple of reasons, because if you're going to do things for a long time, and often these treatments do need to go on as a part of your new routine. So if you make a part of your toilet that you use a bit of lid washing, I find baby shampoo is the easiest thing. So a no tears formula, because you've got it around a lot of the time. You can just use a little bit of foam on a face wash or even your fingers, and I describe it as just shampooing the eyelashes gently. And that really unplugs the glands. That helps the lid margin clean up and then get rid of some of the debris, because it's a fat plugging that causes the problems, and that stasis in the gland causes the dysfunction as well. And so the fat that you've got accumulating can only really be gotten rid of at the lid margin with either a soap or with extreme temperature. So really you're stuck with using a gentle soap. And so the no tears formula shampoos work really well. Another home remedy that's really effective is using bicarb in water. So if you get a litre of water and boil the kettle and use a teaspoon of bicarb, that's extremely safe and gentle on the surface of the eye even. So you can use that and just decant it into a little cup and warm it up. And then you can, because if you've got a kettle boiled, you'd have some water that stock would be clean, and then you can just decant a little bit and use that to wash the lids as well.
Okay, that's good advice.
I think you should see a doctor if you ever have any change to your vision. So if you think your vision is suffering, if your eyes feel painful, and if they're not responding to any if they're not responding really well to those sort of simple conservative treatments such as warm compresses, cleaning of the lashes and lubricating eye drops. The other thing I'd say is it would also be wise to have any child seen by a doctor, only because historically they're underdiagnosed. And, you know, in our line of work, we tend to see the worst of things and not always the best of things. But, you know, we've got certainly have plenty of cases of children who've actually had vision-threatening complications from their blepharitis. So where they'll have involvement of the cornea, which is the clear part of the eye that sits over the top of the coloured part. So the cornea is a place where a contact lens would sit, say. And that's like the clear window that you see through. And one of the extreme complications of blepharitis is scarring of that tissue. So scarring of the cornea, which is called keratitis and corneal scarring. And that can have sort of permanent vision complications. So I think if you've got a child who's got a chronic red eye, or you wonder if they've got any form of significant blepharitis, it'd be worthwhile having them seen too.
Okay. I know you mentioned before about obviously daily looking after cleansing your eye properly and the lids and everything. Are there any other preventative measures that can be implemented?
Diet's meant to be very important, actually. I find I use a lot of the dietary measures as a way of limiting drop treatment and to make the glands healthier. In fact, the medical treatment using either an omega-3, an omega-6 combination and flaxseed oil has definitely got evidence to show that it works. And for example, if you look at the more extreme blepharitis in children where you get chalazions, if I put them on a regime of these supplements with the fish oils, as well as using the lid hygiene, and times I'll also use an oral antibiotic, an antibody that can dry the glands out rather than treat an infection, then 90% of the time I don't need to operate on those kids for chalazions. And so the medical treatment then is certainly also very applicable with adults because it's easy to get the combination supplements in adults, but I reach for that a lot. And with the dry eyes in particular, I find that if you change your diet and make that that side a bit healthier, then it makes a big impact in terms of limiting the drop usage. And you have to eat a lot of salmon to get that amount of omega-3. So you can do it, but it's the same things that are healthy for your brain and for your heart, really eating green leafy vegetables, but good oils as well.
If you've got rosacea, there's often triggers to a blepharitis outbreak or, to a worsening of your blepharitis.
Yeah.
So in the context of rosacea blepharitis, I think knowing your triggers and avoiding them.
Yeah.
So often with rosacea blepharitis, they'll have a flare up if they've been drinking alcohol or had like a sudden change in temperature or, had sort of hot coffee or spicy food. So certainly avoiding those triggers is helpful.
Okay.
The other thing I'd say is that if you know you've got a history of blepharitis, then having sort of a bit of a daily habit to keep it under control can help prevent episodes of worsening. So blepharitis is often a condition where you'll have exacerbations on a baseline of reasonable control. And the way you can sort of reduce those exacerbations is to keep up the cares of your lids, such as warm compress, cleaning and lubricating eye drops, dietary supplementation with omega-3 fish oil, and doing that on a regular basis will reduce the chance of you having those exacerbations.
I think it's a very common condition, so I think it's something that we should be aware of. It's a very important condition because if it's symptomatic, it's something that if it can be managed properly can be life-changing. I know it's not a life-threatening disease in itself, but actually at its worst, it can be sight-threatening. So I think we've got to think of that in combination with every patient, and certainly, again, it's something that we see an extraordinary amount of, and every patient we see for another reason, there's probably a component of the care which comes back to blepharitis as well. So I would just reiterate again, there's some very effective and safe measures, some things that work very well. It can make you feel a lot healthier and happier, and if it improves your vision, then the more treatment that gets done effectively, the better.
Thank you so much for your time. I know our audience will really get a lot of insight into this, eye condition, and I think they'll get a lot out of this.